We want to hear more about these concerns, so joining us now via Zoom is Luke Niforatos, the Executive Vice President of Smart Approaches to Marijuana.
Luke, thank you so much for joining us today.
Thank you for having me on the show, Nathan and Micah.
Well, first, tell us more about your organization, Smart Approaches to Marijuana.
Yeah, so many people probably know us for our work to really hold the marijuana industry accountable and educate people about today's high potency marijuana. But over the last few years, we've expanded our mandate, working to educate folks on drugs like many of the psychedelics that are being voted on the ballot in a number of other states. And so we have a sister organization called the Foundation for Drug Policy Solutions, which you can find at gooddrugpolicy.org. Where we do a lot of work to educate on things like what Colorado's experimenting with, psilocybin and other substances potentially down the road.
As we start to allow the use of psilocybin therapy here in Colorado, what are the biggest concerns you have with the availability of the treatment?
Yeah, so first of all, we're in unprecedented territory here with this program. Never before in the history of this country have we relegated medicine and the study of medicine and what kind of the pros and cons could be to entrepreneurs and political votes. We did that, I guess, with medical marijuana, but here with psychedelics, we're doing it again. Before that, it never had happened. We entrusted the FDA, we entrusted scientists, doctors, and medical professionals to advise us on what medicine is. So right out the gate, I'm very concerned about this program here in Colorado, as well as the program in Oregon, because they're not science or evidence-based. These are programs that only exist because of a political ballot measure where millions of dollars were spent by profit-seeking entrepreneurs, people who are enthusiasts and like to use these substances non-medically themselves. And what we're seeing is really a very familiar trajectory with marijuana was promised as a medical treatment for veterans to solve our PTSD problems, for example. That was one of the highest performing ads for Amendment 64. Here we are again with psilocybin, where it's being promised to treat PTSD for veterans. So my concerns are a few. First of all, the industry capture. We have major Silicon Valley and Wall Street investors who are involved now that are pushing psilocybin and other psychedelic substances for a whole laundry list of ailments. So concerned about the profit incentive. I'm also concerned about the lack of science that is taking play in this process. It's not scientists, there's no clinical trials. In Colorado, they're called natural health medicine centers by law because that's what was voted on. Unfortunately, that is a total misnomer. No scientists have cleared these products to be medicine. There's no dosage. You ask any person at any of the centers that are approved in Colorado what the dose of psilocybin is for PTSD, for example, they will not be able to answer you because there's no dose, because it hasn't been approved by the FDA. In fact, the American Psychiatric Association has said there is insufficient evidence today to warrant the use of psilocybin or other psychedelics for mental health disorders, for example. So the lack of science, very concerning. And finally, the third big concern I have is there's a total lack of knowledge on behalf of the public as to what these substances will do, what the contraindications are. So if you're using certain kind of medication, will psilocybin adversely interact with that medication? What happens if you have an adverse experience in one of these natural health medicine centers? Most of the people are woefully undertrained, not even allowed to prescribe real medications. So there's a lot of concerns there too.
And Luke, there's more studies coming out suggesting that psychedelics like psilocybin are inherently therapeutic. What do you want the public to understand about the risks or limitations of these substances?
There's research that suggests that it has strong therapeutic potential. But it has, again, not been approved by the FDA. Psilocybin has not been approved by any major medical body in the world as a treatment for any disorder at this point. There's a lot of promise, though. There are a number of studies that show this is a breakthrough therapy, or potentially is a breakthrough therapy, which is why the FDA has marked it as such, but has yet to approve it. So I think, the message for me is not that psilocybin can't help anyone. I think there's a strong chance that psilocybin in very controlled and specific settings with very specific ailments will be helpful. However, the message is that we also are seeing caution from the research right now. There was a recent study in the Journal of the American Medical Association that found that people who are using psychedelic substances like psilocybin are 21 times more likely to develop schizophrenia than the general public. A major longitudinal study that was done on users of psilocybin found that more than 40% of participants who had experimented with psilocybin said it was one of the most difficult experiences of their life. And what we're talking about in Colorado is that anybody who walks into one of these natural health medicine centers, anyone, they don't have to have a card like we saw with medical marijuana. You just self-certify. You say, I have whatever disorder and I'd like to receive it, and you will. So when you're talking about 40% of people in some of these large studies saying it's one of the worst experiences of their life, that's a little bit concerning when I think about the promises that are being made to veterans, for example. Veterans, this will treat your PTSD. That's what these companies and advocates are saying. And unfortunately, this could actually have the absolute opposite intended effect for them. It could severely harm people with very serious mental health conditions.
What do you see instead as the responsible path that you say? If it is not the psilocybin path, is there a path that you see forward for people who are dealing with not only PTSD, but other mental health concerns?
We need to trust the scientists. We need to trust our doctors. I mean, if you're not going to trust the scientists and doctors as it relates to medicine, then who are you going to trust? We have the FDA. We've had it for 100 years. We have entrusted the FDA, and they haven't been perfect, such as with opioids, but we've entrusted them, doctors and scientists, to carefully, critically review these medications and tell us what works and what doesn't, what is safe for patients and what is not. I think what we need to do is with psilocybin is wait till the FDA has made a final determination on the various psilocybin products that may be approved for medical use. And until then, I would say buyer beware. I would stay away from these natural health medicine centers. I would go to your doctor instead and ask them for the best evidence-based care.
Luke Niforatos with Smart Approaches to Marijuana, thank you so much for joining us for this Real Talk.